Hello, it's Mark Wallner, welcoming everyone back to Days of Our Cyber Lives, a series dedicated to cybersecurity tips, tricks, red flags, things to be aware of as we have navigated now work from home and cyber living here over the last 13, 14 months. I serve as the executive director of the Indiana Bond Bank, and so glad to co-host this with the state treasurer's office, and joined once again by our co-host, treasurer of the state, Kelly Mitchell.
Well, happy May, Mark, and all our listeners and viewers. There is nothing like May in Indiana. Spring is in full bloom, and of course, we will have the 105th running of the Indianapolis 500. I think a favorite part of most Hoosier lives, and certainly not to be missed.
That is so true. And I think after how challenging and different the last year plus has been, it's just, there's something extra special about the 500 this year.
Oh, absolutely. And we have to remember a big part of the 500 are all the workers behind the scenes who make the racers and the speedway and the whole event just shine. And included in those unsung heroes are the EMS workers. And it just so happens that May is also home to National EMS Week.
I see what you did there, bringing us back to the podcast. I like that.
Well, to help us celebrate the work that EMS does, we are so excited to have the Executive Director of the Indiana Department of Homeland Security, Stephen Cox, join us. Welcome, Stephen.
Hey, thank you very much for having me. I really appreciate it.
Wonderful. And to help connect the dots from a cybersecurity perspective, what Days of Our Cyber Lives podcast would be complete without Chetrice Mosley-Romero? Hey, Chetrice.
Hi, glad to be here.
Chetrice, Director Cox, Stephen, it's great to have you. We have had a lot of amazing guests on the podcast, and Stephen, I'd put your resume up against any of them. We know you were appointed Executive Director of Indiana Department of Homeland Security, gosh, probably just before the pandemic there in January of 2020, yep. Which probably an interesting transition there. And prior to that,
without a doubt.
We know you served the state as State Fire Marshal, and then spent 26 years before that at the South Bend Fire Department, including 12 years in executive leadership. In addition to serving as fire chief, we know many of our firefighters also serve in EMS capacities, paramedic capacities. So love and are very excited to hear about your passion for EMS. And prior to that, I know you served in the U.S. Army as a combat medic during Desert Shield, Desert Storm, and hold a bachelor's from IU. So we are so excited to have you.
That is amazing. Indiana is truly fortunate to have your service in this critical role.
Well, I want to thank you, Mark, Kelly, and Chetrice. I'm happy to be here, and I appreciate the work you all are doing with this podcast and the continued focus on cybersecurity. It's obviously something we all need to be discussing regularly, and it's something that continues to permeate everything we do in the preparedness and response areas. Every public safety sector works with technology today in some way, shape, or form. And so it's really an important aspect of what we do at Indiana Department of Homeland Security.
Yep, and I would be remiss to not mention that Director Cox is also the chairman of the Indiana Executive Council on Cybersecurity appointed by the governor, and very specific in his executive order that Homeland Security lead the efforts in cybersecurity. But I've always appreciated working with Stephen and, him just very much to many things I'm sure we'll talk about later is that, not one entity does this alone. So, to collaborate with all the parts that are moving really does make a big difference when it comes to how we move forward with cybersecurity. So.
Thank you, Chetrice. And Stephen, maybe just first topic broadly for listeners, folks like me, we know we're in a National EMS Week, but talked about paramedics, EMS, EMT. Can you help sort out, are those all the same things? Or are those different terms of art for different job responsibilities?
Well, thanks for asking that question, Mark. So oftentimes it's confusing to a lot of folks who hear terms like EMS, EMT, EMR. And then they aren't really sure how a paramedic fits into all of that. So I'm happy to go ahead and discern them. So EMS is emergency medical services. And so that's just a term that basically encompasses the entirety of emergency medical services. That includes not just ambulance service, but also, first response agencies such as fire departments, both career and volunteer, that, as you mentioned before, do provide that service. And I can speak to that in a little bit as well. An EMT is an emergency medical technician, and that's basically the baseline certification for somebody who responds and provides emergency medical care on a scene when somebody calls 911. An EMR is a step below an EMT, so they don't have as broad a level of training. Typically, oftentimes that you find EMRs working in volunteer fire departments because those folks are actually working different jobs, and so the amount of hours required to achieve that level of certification are less, and it focuses very much so on those first response activities that individuals take part in when someone calls 911, as opposed to advanced life support type of techniques. Paramedics are at the advanced life support level and provide more or less a lot of the services that you would receive when you go to the emergency room, and they're more or less an extension of a physician in the field. And in fact, a paramedic typically works under the license of the medical director physician that sponsors their agency. So paramedics do everything from performing and interpreting EKGs for people with heart troubles, administering IV medications, starting IVs, placing endotracheal tubes for people that have stopped breathing. They administer narcotic medications. I mean, the gamut is full, and ultimately their job is, if they have a critical patient, it's to be able to stabilize that critical patient, to deliver them to definitive care in the hospital, to get them to a surgical procedure or whatever. And they offer all three levels offer life-saving modalities to treat patients, to get them to that definitive care in the emergency department.
Thank you so much for setting a stage. I had no idea, and I
Sure.
think that really helps, I think, the rest of our conversations. Thank you, Stephen.
Sure.
Hey, Stephen, one thing we've learned on this podcast is just how much the pandemic has created opportunities for cyber criminals. Can you tell us what the role of EMS has been in this pandemic response, and how has that differed from normal times?
So as the pandemic hit, if there's a silver lining that we can point out, it's the impact of EMS. The EMS has had a very significant impact, right? So if you think about it, EMS personnel respond to emergency calls every day, and they have close contact with people from all walks of life. And whether that's in an ambulance, a fire truck, or otherwise, and frankly, in the state of Indiana, 70% of EMS providers actually work in the fire service. So a significant portion of that first response from an EMS perspective comes from the fire service in the state of Indiana. As a fire chief, I was frequently asked the question, why, when I called 911 and asked for an ambulance, did a fire truck arrive? And so I think it's important for us to understand that it, specifically in municipalities in the state, there's a first response piece where fire trucks or fire stations are more frequently located in municipalities, and typically have a shorter response time to a medical emergency. And since those individuals actually have a shorter response time, plus they have the medical training, they can actually offer that medical care quicker than typically an ambulance would. So they act as a first responder, and I'm sure you've heard that term before, and basically can start to stabilize those patients even before an ambulance arrives. So that's kind of a tiered response, is what we would call that. So when COVID-19 hit the country, EMS personnel were asked to put themselves into harm's way without a full understanding early on of what risk they actually faced. I think we all saw that in not just the state, but the country, was that there was a whole lot that was unknown about COVID, right? So in spite of that, we had EMS responders all over the country still performing their job because people were calling. It wasn't just from difficulty breathing from COVID specifically, but fewer people were going to the emergency room because they were worried about becoming infected with COVID. So oftentimes those individuals, their case got worse and worse and worse before they finally called 911. So individuals in the state of Indiana, in a typical year, we run roughly 100,000 calls a year amongst all the EMS agencies in the state. And some of the other issues that they've run into include ensuring that you have the right protective equipment. So PPE was a term that probably up until March of last year, nobody had ever heard, or few people had heard, unless you were in the medical field, right? Or other, areas where you would use PPE. So people in EMS weren't sure if they had the appropriate PPE because there was so much unknown about the disease, right? And what kind of necessary precautions came along with that. They had to completely change protocols because of those precautions. Frequently, EMS providers, in a normal situation, they would just go to somebody's house for a difficulty breathing case. But as it was understood that those exposures would become more and more frequent, EMS providers started changing their protocols to where they might call back to the individual to go through basically a checklist to see if this person might potentially have COVID-19. And if that were the case, their treatment might be different. Or if they weren't having significant symptoms, they might not transport them to the hospital and expose all the staff at the hospital and other patients to the disease. So those are just a couple of examples. You have to serve and treat others while also remembering to protect yourself so that you can always go home to your family at the end of the day. That's something that every single EMS responder thinks about when they go on every single call, from traffic or violent type of cases and things like that. This just added another risk that they had to deal with when they got to a call, right? We heard a lot about doctors and nurses dealing with overcrowded hospitals, but EMS and firefighters also were on the front lines. They were out there putting the public first and ultimately bringing those patients to those overcrowded hospitals, right? And something else that maybe a lot of the public doesn't know is that the governor's executive orders throughout the pandemic have expanded what EMS could do in several different really interesting ways, right? One of them allowed retired EMS providers to be able to come back to work and help out. And that may not seem like a big deal, but especially in some of the more rural parts of the state where you had volunteers going out and also, again, back to the volunteers, those volunteer firefighters, they work other jobs, right? So oftentimes they're working in a job, they get a call, they respond. And what they found in a lot of these rural areas was that they had fewer and fewer people volunteering to do that job for the simple fact of these higher risks now from COVID. So this was a big deal. We had a lot of folks come forward and say, hey, listen, I'm actually a retired firefighter or EMS, EMT or paramedic, but I'm happy to come back and volunteer in this area if I could be allowed to do that. So the governor, there were some stipulations added into that particular executive order, but it actually increased our pool of individuals that could actually respond to calls. So that specifically helped in those rural areas. EMS providers are able to help with the vaccination effort in staffing vaccination clinics. So as a part of the standard of care that EMS providers provide or perform, vaccinations aren't a typical part of that. So one of the executive orders allowed EMS providers all the way down to the EMT level to be able to help give vaccinations. So they boosted in a lot of parts of the state right now. We actually have EMS providers going out assisting the health department in those parts of the state by giving the vaccine, COVID vaccine, to people because in a lot of parts of the state, the local health departments aren't staffed beyond a few people, and they just don't have the capacity to be able to give an adequate amount of vaccine in those counties. The Homebound Hoosiers program, which we've talked about on the governor's press briefings, is an amazing program. So with the help of FSSA, we've created a portal where individuals that are homebound and don't have the mobility to be able to get to a vaccination site have been able to be placed into the portal. And then at the end of the day in those counties, we've helped make a connection between Department of Health, FSSA, and IDHS to where EMS providers are contacted. And I'll just use this as an example. Say in Morgan County, the health department is running a vaccination clinic and they have an additional 8 doses left at the end of the day. They've given out all their other doses, but they don't have anybody else coming forward to get a vaccine. So then what the health department does at the end of the day is they contact the EMS folks. The EMS folks that are already part of the Who's Your Homebound program then go into the portal. They identify anyone that lives in Morgan County that needs to get vaccinated on that program. They go pick up those 8 doses, and then they go in their ambulance or in a paramedic chase vehicle to that individual's home, and they administer the vaccine. And then basically we then have those individuals go back and do all the reporting requirements for the state through the local health department to make sure that then they're not only annotated in the state's health portal as having received the vaccine, but above and beyond that, then we also get them scheduled for a second vaccine if they don't have the J&J. So it's been a really successful program, and the EMS folks have been an integral part of that program. We couldn't have done it without them.
So I think that was a lot.
So, sorry.
No. I love everything about it. I mean, I think it's, you hear these kind of basically headlines, right, in the news or on social media, and I think it most certainly is understated on how complex the whole response that that Stephen's been leading with the governor has been, right, and and developing from setting it up so that people can come forward and volunteer to developing complex data systems to be able to efficiently and effectively help people who would otherwise not be able to get the help because of everything that's been going on. And so I think it's a lot, but it's good in the way that it's not as simple as we're just giving away shot. I mean, it's very thoughtful, it's thorough, and it's documented. And I think at least for me as a citizen, I appreciate that for sure. Most certainly as a mother of 4 kids, with 2 being high risk, and a husband who's in emergency services too, I definitely can appreciate everything going on. And I'm sure Mark and Kelly, just because of the way this podcast has gone, they hear things like data, and they hear things like these mobility things, and they're like, yep, that's a cyber. I always tell people who are like, wait, how is cyber related to something? I'm like, do they use things that plug into the wall? Yes, then it has cyber involved. Except, of course, with what Stephen was talking about, you're dealing with life and death situations, and my heart goes out to people. Just what we've also even heard with the other first responders is that people, like from the beginning, with a lot of unknown things, was walking in and putting themselves at risks. And I think that only adds more of and what we did see from a cyber perspective is a significant increase of attacks on healthcare facilities, on first responder facilities, our 911 centers, our because our state systems, our local government systems, because cyber actors are looking for these vulnerabilities when we're very preoccupied with developing things quickly. And we're, very preoccupied with the fact that we're trying to help as many people. And it is the perfect ground for basically a perfect storm of a lot of things. And I think it's interesting within, I was kind of sitting back monitoring in my cyber world as everything was getting locked down. And I'm sure Stephen remembered, me calling him saying, hey, have you heard about that cyber attempt on the human health services at a federal level? And then all of a sudden we started getting flooded with a lot of other healthcare facilities saying, hey, we're seeing a big increase. And that was, so here I was like, okay, Stephen, you let me know if you need help. And then all of a sudden we were staying up all the EOC, including the cyber component. because it became such a big thing. So so I think most certainly with the COVID, it really has been able to change a lot of how we see even the simplest, what may seem like a simple service, it really isn't, because there's so many layers behind that is, you know, very human focused as well as technology focused, which you know, I'm sure there are lots of things there that can, you know, piggyback off of a lot of what Stephen had said. So, you know, even like the record keeping, right, from the ambulance's perspective or their spawner's perspective, or, you know, that communication that's happening real time between the first responder and the hospital and the medical services they're needing, you know, all of that is on data systems that are consistently being targeted and attacked by bad cyber actors. And all you need is for one system to go down for us to have some serious problems that just throw a wrench into already what's a really, really stressful, crappy situation, on top of, you know, everything else, that all the new protocols and things that I'm sure EMS people this last year has had to take on, in addition to the extra thing of these ones and zeros that can mess up their day even more, right?
You know, when you talk about how you connect the dots, Chetrice, between this and cyber issues, I keep going back to, and I think I've said this on a podcast before, when I was attending the U.S. Army War College, they had a movie screen, and nothing, or the only 3 words on that screen were "nothing is safe," and that had to do with cyber. And so we can connect the dots, I think, to just about everything with cybersecurity. And Stephen, I just wanted to ask, what do you see, what adaptations have you made that you might continue making in a post-COVID, hopefully soon, environment as a new best practice?
Sure. So there's a whole lot of unknowns that we do have with the virus and what's going to be required from a medical and emergency response perspective. We know that EMS is a critical component of that. I will say a couple of things, and I think Chetrice just hit on a couple of them. The record keeping from ambulance services it's really important that we keep that encrypted and make sure that we have all the safeguards in place. There's a couple of reasons for that. Number one, and Chetrice hit the nail on the head, there have been multiple different attempts, not just through the typical ransomware or phishing attempts and things along those lines, but even more significant or advanced ways for folks to be able to hack them. And a lot of that's been because of cyber criminal activity, specific to the fact that there's a ton of protected health information, billing information, and basically individuals like their social security numbers and identity theft is a huge issue associated with that particular information. However, it's really important that we use that, we continue to utilize that, because information sharing in the EMS world, in the medical world, is so important, right? So I mentioned community paramedicine just a little bit ago, or I actually may not have, but the Hoosier Homebound program is kind of an extension of community paramedicine or mobile integrated health, which is something that we're working on right now in the state. And basically what that does is that it allows for the continuum of care from the field. So an individual, when an ambulance goes and picks a patient up, drives the patient to the hospital after treatment, and then passes the patient off to the hospital. It's incredibly important that everything that occurred is documented for that individual's further care down the road, right? So that way a hospitalist can actually go in after surgery, identify all the procedures, or have a historical perspective of what occurred or what happened to that patient to be able to adequately treat them, right? So it's incredibly important that we document everything, but it's really also really important for us to be able to protect that, right? In a way that we can be confident that it is in fact protected. Unfortunately, I'm not going to go into all the different ways that we might do that on the podcast, obviously, for security reasons, but that is something that every single EMS agency takes incredibly seriously and works with their own providers to make sure that their information is safeguarded, even though information sharing has to take place between these different entities that are treating the patients to make sure that their care is appropriate. Now, I mentioned community paramedicine just a minute ago. One of the things that we've been doing as an initiative in the state of Indiana, and nationwide they've been doing this, is bringing care to individuals who are underserved. And what I mean by this is that several years back, the fire service and EMS have noticed that certain individuals have continued to call for ambulances multiple times over a short period of time. It's really easy for us to identify those patients. And what we've come to find is frequently those people aren't even calling us for medical problems, but it's a path of least resistance, right? They may not have a family practitioner. They may not have resources. They may not have insurance. They may not have family available or transportation. They may not have money to be able to refill medication. But what they do know to be true is that when they call 911, somebody comes and takes care of whatever needs that they have. And so what we started doing was we started identifying these individuals in communities, and instead of actually responding to them when they're in crisis mode, just making routine visits to them to find out what the core reason is for them calling 911, and seeing if we can't solve that without having them make an emergency call. And what we found to be true is that most of these people, and I'll give a prime example in South Bend, we had a gentleman that was calling very frequently because of ground level falls. We sent our community paramedic out to his house, and she said, "Hey, you've been falling a lot. We've responded 10 times in the last month to your house. Can we just look around the house and find out exactly?" So she gave him a quick training on safeguarding his home. And ultimately through that conversation, he said, "You know, one of the things, I walk with a walker, and one of the things that I can't do is hold myself up in the shower. So I fall in the shower every time I get in the shower, and I really need a bar." So she was really resourceful. So she contacted a couple of plumbing places, one of which actually came out and installed a bar for this guy in his house. And we never went back out to his house again because he had something to hold on to when he was in the shower. It was as simple as that. But if you can think about this gentleman's quality of life, right, and how that was impacted by such an easy fix. And what we found to be true was that happened over and over again. So one of the things that was really cool about working on this particular initiative is that in connection with FSSA, Dr. Sullivan and her team, and Dr. Box and her team at Health, we looked at the idea of making sure that these folks that are homebound, they end up getting vaccinations. And so we kind of brought both of these programs together. And so as we move forward, I guess our idea is to be able to expand on this. And in fact, the governor actually this past year made community paramedicine part of one of his health pillar on his agenda. So we're working on several different initiatives within DHS, FSSA, and Health to kind of in combo to I guess broaden this particular program throughout the state. Different communities have embraced it in different ways. And so what we're trying to do is bring some standards to it and actually bring some, not just attention, but hopefully some funding and some other ways in which we can support it, because we know this program is going to have a positive effect on basically all the communities that embrace it.
Well, that's wonderful. Thank you for that.
Sure.
We have a few minutes, and I would love to touch on something I'm pretty familiar with, our 911 operators and telecommunicators. Changing how they're viewed. Police and fire are held, and rightly so, as first responders, but people don't often view 911 operators or EMS with that same lens.
Sure. So thanks, Kelly. That's been an issue for a long time, primarily because EMS and our telecommunicators work behind the scenes frequently, and what the public sometimes doesn't realize is these firefighters, police officers, and other public safety personnel, they wouldn't be able to do their job without the support of EMS. It's just plain and simple, right? So the traditional view of EMS is that all they do is they come out, they pick up a patient and they transport them to the hospital. And so oftentimes people just think of EMS as an ambulance, and it's just a big part of what they do. And so that's kind of what I've been speaking to in the podcast here. But EMS just does a lot more than that. And obviously we're going to continue to expand that in the future. Like I was talking about community paramedicine. We talked about the governor's agenda item to include that. The whole idea of which is to take healthcare to people in the community. One of the things as a fire chief that I always used to sell my city council on this and my mayor was, back in the day, doctors made house calls, right? Mm-hmm. And so this is a way in which we are able to fill that role again and make it a much more personable way of providing healthcare in a way to people that don't have the ability to get the resources that they need to take care of themselves. And so basically it's helping to fill a gap in the modern healthcare system the way it's built out right now. And really it's different in both urban and rural areas, right? So in rural areas, sometimes a response time for 911 can be an extended period of time just because of the distance factor, right? And in the urban setting, typically people have more resources close by because of everything's more centralized, right? And what we're trying to do is change the norm and the perception of EMS in that it is a part of the first response activities that take place.
And I think, from like knowing where it's going to, a lot of that, and Stephen, I'm sure you have a really good example. I think I had seen something about some heart stuff, like you're bringing in smart technology, right? If you have one person volunteering and you don't have, a crew of 5 people dealing with a heart attack or dealing with, even, providing medicine while also taking care of, vitals, those bedside smart devices, it really becomes such an issue for not just healthcare systems, because you hear a lot about that, right? We've talked a lot about that on this podcast. Like you talk about hospitals getting hacked and that kind of thing, but all those systems are connected from the beginning of care, as Stephen was talking about, from the moment that somebody arrives, whether with a fire department or an ambulance or whatever the EMS service is, they're bringing on ground a lot of these smart devices that most certainly help in them being as efficient and save lives, but then also becomes another way of people to affect how we can provide quality services, quality of life services, because they just become another avenue of which, people take advantage of. So I think it's also really important as these things grow. And I know it's most certainly on Stephen's radar, especially being the chair of the Council on Cybersecurity, is that as we look at these smart devices, how do we educate local governments on choosing vendors, for example, right? Are you, if you're getting a smart device for your fire department, that's great. It's going to save lives, but make sure that if it's connecting to a larger system like a health system or a hospital or a health department, that you're asking questions like, where's your information? Where's do they do cyber risk analysis on those devices? Are they patching it automatically, or you have to do it? How is the password on it? We've had situations where people have hacked into these bedside or transport devices because they still have the manufacturing password on it. And it seems so simple, but people just want to go for convenience. But those types of things make such a difference that if you go down because it was hacked, then now you're dealing with not having everything you have, you can have to save and be on the first responder to a scene. And you don't ever want to be in that situation just because you didn't change a password and or you didn't back up your systems, or you didn't patch your system that's connected to a hospital system. So, I think as they expand these things and bring up technology, it's going to be such an important thing, when people, have patients that people have to go through these extra, steps, but they're life-saving steps as well.
Well, this has been just an amazing week to celebrate, or amazing conversation to celebrate National EMS Week. It's been robust. Stephen, thank you for joining us. Chetrice, thank you, as always, for joining us as a guest.
It's my pleasure.
Yeah, absolutely. Thank you.
And love it, Steve, if you could come back on sometime, as there's so much more that I know IDHS does that would fit perfectly with our Days of Cyber Lives theme on this podcast series.
Yeah, that'd be great. IDHS is such a very diverse agency in what we do. And so we try to serve the public in a variety of ways. And I always enjoy the opportunity to discuss the great work taking place. Absolutely.
Well, as always, enjoy the state partnership with DHS, the State Treasurer's Office, the Indiana Bond Bank. We exist to serve local units of government and all those who work to serve the public. And this was just another great conversation along these lines. So if you liked what you heard, please subscribe to our Days of the Cyber Lives podcast series, either through YouTube and watch, or Apple Podcasts, or your favorite podcast audio platform. We are here. You can get every back episode of this series through either media. Until the next time, my name is Mark Wollner. I am the Executive Director of the Indiana Bond Bank.
Thank you for listening. This is State Treasurer Kelly Mitchell signing off this episode of Days of Our Cyber Lives for the Indiana Bondcast.
Thank you so much. Take care.
Thank you.